My name is Cole Sedar. I'm a graduating sleep medicine fellow at the University of Toledo. So I looked at the University of Toledo because I'd come here as part of my undergrad training and looked through the program and saw the wide scope of the various teaching attendings. Because most sleep medicine programs are a sub-branch of the pulmonary department and you're taught mostly by pulmonary sleep physicians. When I looked at this program, that we have a variety of sleep medicine attendings that have backgrounds from neurology, pediatrics, sleep, psychiatry, neurology, and internal medicine. And such a broad expanse of teaching physicians leads to a bunch of different points of view, different inputs, and is a real strength to the program. Having a sleep medicine program director who does only sleep, not sleep in pulmonary or sleep in neurology, but just sleep, is a huge strength to the program because he is really well versed and has a mastery of the knowledge of sleep medicine. One major strength of the program is that we started with an EEG rotation. So after learning kind of the basics of sleep medicine, I spent a month learning EEGs with the neurology department and the neurophysiology team, and it really gave me a really strong background for EEGs, and I've been able to identify, seizure activity during the polysomnograms and on the various sleep studies, able to rule out seizure activity in sleep studies, and I think it has given me a really strong background in seizure, which is important when you're looking at EEGs, on your sleep studies on a weekly basis. So my experiences at UT have definitely highlighted how much time I want to spend practicing sleep medicine in the future. Initially I had planned on maybe doing like a 30-30-30 model of 30% sleep, 30% pulmonary, 30% critical care. But at this point I think I want to make sleep a majority part of my practice. Dr. Egelian is so passionate about sleep medicine that he kind of shares that passion and gets all his learners really excited about sleep medicine, and has really shown me how many other aspects to sleep medicine there are outside of sleep apnea. I'm an internist by training and have had minimal pediatric experience outside of a rotation in medical school, so I was really intimidated about when I realized that I would have to start caring for kids as a sleep medicine physician. But the pediatric sleep clinic here is really robust. It's got strong attendings, it's a phenomenal program, and within a couple months I was very comfortable taking care of pediatric patients, interviewing them, speaking with the parents, and it's been a phenomenal experience. There's a strong neurology component to the program, and you spend essentially 2 months working with the different neurology groups at ProMedica, and you get plenty of exposure to EEGs, to seizure. It has been inspiring, rewarding, and just overall a phenomenal experience. Dr. Egelian's passion for sleep medicine really gets all the learners around him fired up about sleep medicine, and really it inspires us all. I have learned an incredibly large amount in just a one-year program, and it's really impressive that the program focuses on the learners as learners. You're not here to do scut work. You're not here to get numbers of patients seen in the clinic. You're here to learn, and with every patient encounter, the attendings take time with you to go over that patient so you can find a learning point in every encounter. You never feel like you're here just to get the patient seen and get them moving through the clinic. The program really sets a focus on your learning, your education, and make it very clear from the very first day that this program is here to teach you sleep medicine, and that is what it focuses on for the whole year. Dr. Egelian has built a phenomenal hybrid style program where you learn from textbooks, from one-on-one lectures, from video recorded lectures, from clinical vignettes, from patient encounters in the clinic, and he really melds it all into such a way that you're immersed in sleep medicine and you can master the topic in the short one-year program that you have to learn. Yeah, I would definitely recommend this program without any hesitation. If you have any interest in sleep medicine, reach out to Dr. Gillian, reach out to any of the faculty. It's been a phenomenal experience that I would do 100 times over. This has been my absolute favorite year of practice since I became a physician, and an experience that I will really appreciate for the rest of my career. Man, this is tough. This is like such an amazing program. I just can't say why it's so great. Shoot.